Knock knock. Hi, my name is Tara and I'm going to be your student nurse today. So I'm just going to close the curtain here for some privacy. I'm going to wash my hands. And can I get your name and date of birth?
Ari Gennaro, 62592.
Perfect. So I'm going to be doing a head-to-toe assessment on you today. And as I go through the varying steps, I'll just kind of explain what's going on.
Okay.
So first I'm going to clean my stethoscope and I'm going to take some of your vital signs. So I'm just going to clean both sides here. And I am going to start with your blood pressure, okay?
Okay.
Thank you. Sorry. Okay. And I'm just going to find your pulse here. This is a two-step method. Okay, you can rest your arm here. And I'm going to take your pulse ox. So you see one of your fingers here. Perfect. And then I'm just going to take your temperature. Perfect. And your pulse ox is within normal limits. So thank you. And now I'm just going to finish your blood pressure. So I'm just going to clean my stethoscope again. Okay. Perfect. Your blood pressure was within normal limits. Thank you. Okay. This over here. And I'm just going to clean my stethoscope while I have it. And I'm just going to check your pulse for 1 minute. Okay, and I was also checking your respiration rate. So pulse and respiration rate are within normal limits.
Okay.
Are you experiencing any pain today?
Yes.
where is your pain located?
It's on my right toe.
Okay, and when did this pain start?
Last night when I hit it with a chair.
Okay, and on a scale of 1 to 10, how would you rate this pain?
I'd say about 2.
Okay, so would you say this is a tolerable pain for you?
Yes.
Okay, and does anything make this pain better?
Just resting it.
And does anything make it worse?
Standing for a long time.
Okay, and does the pain radiate to any other part of your foot or body?
No, it just stays there. Yeah.
Okay, and is it a dull or sharp pain?
I'd say a dull pain.
Okay.
Mm-hmm.
Okay, so I'll let your doctor know about that and like mark it down in the chart.
Mm-hmm.
Okay. So now I'm gonna do a neurological exam. So I know previous you had stated your name and date of birth, so I know you're obviously alert. But can you tell me where you are?
I'm at the clinic.
Okay, and do you know the date?
It's April 21st, 2022.
Okay, perfect. And as you're talking, you're not slurring, so your speech is clear. So you're alert and oriented times 3, so that's good. And now I'm just gonna check your pupillary response. I'm gonna inspect them first. So your pupils are round and equal bilaterally. And now I'm just gonna use my pen light here and shine some light into each one of your eyes. Okay, perfect. So your pupils are equal to light and accommodating. And now I'm gonna move this, and I just want you to keep your head in the same position, but just follow this with your eyes. Okay, perfect. So your pupils are equal to light and accommodating. So next, is it okay if I use this pen on your skin?
Yeah.
Okay, so I am gonna do 2 sensations. So this is gonna be a dull sensation, and this is gonna be a sharp sensation. So I'm gonna have you close your eyes, and I'm gonna use this, and I just wanted you to tell me what sensation you feel and where.
Okay. It's a dull on my right leg.
Okay.
It's sharp on my left leg. A dull on my left arm. And a sharp on my right arm.
Okay, perfect, very good. And with any of that, did you experience any pain?
No.
Okay, so I'm just gonna have you squeeze my hand.
Okay.
Okay, perfect. And then I'm just gonna have you push up against my hands, or push down, sorry. Okay, perfect. And now I'm gonna have you flex your toes to your nose, and then press down on my feet like gas pedals. Okay, so now I'm just gonna wash my hand. Okay, and so I've done that. So now I am just going to inspect around your heart area.
Okay.
So on inspection, I don't see any abnormalities. And now I'm just gonna palpate the area lightly.
Okay.
So on palpation, I felt no grills, vibrations, or bumps, so that's good. And now I'm just gonna listen with my stethoscope. So before I put it on your skin, I'm just gonna clean it. Sorry. Okay, so using the diaphragm side, I'm gonna listen to aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, and now using the other side, I'm going to do the same thing. So aortic, pulmonic, Erb's point, tricuspid, and mitral. Good. Perfect. I'm just going to clean my stethoscope here. And now I am going to check your fingers, so I'm just going to squeeze each one of them. Okay, and I'm going to do the same thing on your toes. Okay, perfect. So I'm just going to wash my hands really quick, but I'm also going to be feeling your pulses and your feet. So. Okay, all within good limits, all good. So I'm just gonna wash my hands again, and with just working on your legs, I notice that your legs are functioning fine and you can move them. So now I am going to do your respiratory assessment. So I'm just gonna have you sit up, and on anterior and posterior inspection, your chest is rising and falling equally. There's no signs of barreled chest, and you're not using your accessory muscles when you're breathing. So it's all very good. And now I am going to listen with my stethoscope to your lung function. So I'm just going to clean my stethoscope here before I put it on. And when I'm using the stethoscope, I'm just going to have you breathe in and out every time I move it, okay?
Okay.
Okay, perfect. I'm just going to have you sit up and do the same thing on your back. So just every time breathe in and out. Okay, perfect. So I'm just going to clean my stethoscope here. So have you been experiencing a cough?
No. Oh, yes, actually.
Okay. And with your cough, have you had any sputum?
No, it's pretty dry.
Okay, so you've just been experiencing a dry cough.
Uh-huh.
Okay. And have you noted any edema in your arms or legs? So like any swelling?
No.
Okay. So have you experienced any calf tenderness or pain?
No.
Okay. I am just going to palpate your lower extremities to check for any edema and to see if your calves have any tenderness.
Oh, okay.
So I'm just going to palpate here. Okay, so I have no edema noted here, and I'm just going to check your calves. Okay, and I'm just going to check your upper your arms for any
Okay.
edema. Okay. So I noted no edema. Did you experience any pain with that?
No.
Okay. So now I am going to just assess your abdomen. So I'm
Okay.
gonna have you lay down. Okay, so on inspection, I see that your umbilicus is midline. There's no distension and your abdomen appears flat. So that's all good. Now I'm just gonna listen in 4 parts of your abdomen. Yeah, so I'm just gonna clean the stethoscope. Okay. Okay, so I heard no abnormal bowel sounds, so that's all good. Everything seems normal there. So I'm just gonna clean my stethoscope, and now I'm gonna lightly palpate the area just to feel any abnormalities. Okay, so everything feels good. No abnormalities there. And now I'm just gonna ask you a few questions.
Okay.
So, do you pass gas every day?
Yes.
Okay.
Every day.
And do you experience any nausea or vomiting?
No.
Okay. When was your last bowel movement?
This morning.
And how would you describe the consistency of it?
It was like full
And,
or formed.
okay. So, formed, and would you say it was like a small amount, a medium amount?
I would say a medium amount.
Okay, and what color was it?
It was brown.
Okay. And you had no pain with your bowel movement?
No.
Okay. Good. And how often do you go?
I would say once a day.
So once a day? Okay, that's good. And now with your urination, how often do you void in a day?
I would say once every 2 hours.
Okay. And would you say it's usually a small, medium, large amount?
I would say about medium.
Okay. And is there any odor with it?
No
Was your last void, did you notice that it was cloudy or was it pretty clear?
odor. Clear.
Okay. And is that normally how your urine is?
Yes. Yeah, normally clear.
Okay. And what color was your
It
urine?
was yellow.
Okay. Perfect. So that's good. We got that all checked out. So now I'm just going to assess your skin.
Okay.
So on inspection here of your upper and lower extremities, the skin seems within normal limits. I see no redness or blotching, so that's good. So I'm just gonna wash my hands really quick before I touch your face. I'm just gonna feel for temperature. So you're warm to the touch. Okay, and now I'm just gonna assess for moisture. So okay, so your temperature is warm throughout and your moisture is adequate throughout. So now I'm just gonna check your back. So on your back, the skin is within normal limits. I see no redness or blotching. And let me just see here. On temperature, it's warm throughout, or temperature warm throughout, and moisture is adequate. And now I'm just gonna check your heels. So on inspection, there's no redness or blotching. For moisture, adequate and warm throughout. So I'm just gonna wash my hands real quickly here, and I see no scars, lesions, or wounds on inspection, so that's good. So I'm gonna hand you your call light. I'm gonna pull open the curtains for you. I'm gonna wash my hands here, and if you need anything, let me know. And I'm also gonna lower the bed for you, and then I'll rewash my hands. But thank you.